Assalamu alaikum. Ultrascan Diagnostics. Here, this is the CBCT of the patient which you had requested. The area of interest is the lower left wisdom tooth and its proximity to the inferior alveolar nerve. This is the proximal view, which is basically the transaxial view. So here you can very clearly see we've got the lower right wisdom tooth. As we will move from the mesial root, the inferior alveolar nerve is present a millimeter away, and it is lingually placed, and the tooth is buccally placed. As we are moving distally, this is the interradicular area, and you can see that the inferior alveolar nerve is now being compressed by the roots of the inferior alveolar nerve. We're going to remove the highlighting so that you can see that the inferior alveolar nerve is this close to the roots of the lower left wisdom tooth. As we move further distally, you will be able to see that the normal round shape of the inferior alveolar canal turns into a bean shape, which means it's being extremely compressed by the lower left wisdom tooth, and the compression goes all the way towards the distal aspect of the tooth. So here again I will show you this is the distal root compressing. The mesial root doesn't compress, it actually just is next to it, but at one point it does also compress, and the distal root completely compresses the inferior alveolar nerve. This is the axial view or the top to bottom view. The axial view will be able to see the inferior alveolar nerve as we come down gets compressed right here at this point. There we go. At this point, it gets compressed by the distal as well as the mesial rods, and is going to be a significant challenge while extracting the lower left wisdom tooth. And this is the axial view of the upper right 3, 4, and 5. So 5 is not present. There is the upper right 3 and there is the upper right 4. I think for orthodontic purposes, the premolar, the first premolar or the second premolar were removed. I think the first premolar here in this case was maybe removed. So looking at the axial view, we don't see any cracks in the canine or the premolar. Nothing or no significant periapical radiolucencies, nothing of any sort that we can identify as a fracture line. A very mild line can be seen here. There we go. Right at the apical 1/3, but this could just be can't be. So right at the apical third right there, middle to apical third, we can see a line on the mesial aspect, and this is where it corresponds to with the clinical pain. So then you can identify it as a crack, but we can't be certain if this is in fact a crack because it's just at one aspect. So if there are any further questions regarding this case, please feel free to reach to our team. Thank you very much.